This organization is called Naseeha, and let's bring him on based in Canada. It's a hotline if a youth is suicidal. And we ask Allah Afi and Salama from that, but I found this was an excellent organization. It's a non-profit organization. Brother Nasir, Jazakallah khairan for coming on. Welcome to the live stream. Why don't you tell us right away, what is the organization? What was the impetus to the organization too?
The point of it all is, see, what we're finding, the majority of the calls we get, especially with what's going on now overseas in the Middle East, we get a lot of calls. People are sad, they're depressed, they're dismayed, they don't know what to do. And what we find is the best thing for anybody is to be able to talk to somebody. And unfortunately, there's so much stigma in our community around mental health, around depression. As you stated, it's frowned upon to even say that you're feeling sad or depressed. Why are you sad? Why are you depressed? Do some dhikr and you'll be okay. Yep. Unfortunately, not everybody, to your point, has had that background, has had that training. Not everybody has a sheikh or a teacher that they can sit with and talk to. So this helpline, which is toll-free, it's confidential, it's non-judgmental, is for people to pick up the phone and call. And it's not just young people. We're getting calls from adults. It's interesting, what one of the directors told me, it was a very sad and emotional story. He said he recalled receiving a gift in the mail. It was a handwritten letter with a small tasbih from somebody in Palestine who wrote them a letter and said, I've been using your service and it's helped me to get through some very trying times. That was about 2 years ago. We don't know where that person is or what's happened to them. So this is the condition of the community, and they just need somebody to talk to. So we've set up this helpline, and it's interesting. So we have the helpline. We were getting calls. We get about 300-400 calls a month. And then the pandemic happened. Everybody's at home. What do you think happened to the number of calls? Would
Probably
they go up or would
through
they
the roof?
No, the calls dropped.
Oh, really? Because people got support. They got their family support.
No, it's because young
they didn't
people
have privacy.
You're sitting in the room with everybody else.
Yeah.
How are you going to pick up the phone and call somebody and say, "Hey, I'm feeling depressed"? So we started a text line, and our text numbers went through the roof. Once or twice a month, I get stories back where we've actually prevented a suicide by text.
SubhanAllah.
So it's an important service, and really, I just wanted the opportunity to come on here and just let your audience know that, look, not everybody is as lucky as you to have somebody like Dr. Shadee to talk to and bounce these ideas off of. And if you or somebody is struggling, is dealing with these problems, pick up the phone, call Naseeha. It's really simple, 1-866-Naseeha. You can call or you can text. And secondly, because we are now expanding into the US, we need help. We need volunteers. If you're interested in helping, I know the New Jersey community. I grew up in the New Jersey community. I know people want to roll up their sleeves and help. This is a really, really important task. People need our help. Yeah.
What are the qualifications of someone who wants to help?
So we are starting to look for people now who are in the field or are studying in the field of mental health or medicine to come on as counselors. We do have a training program that we put them through. All of our counselors, by the way, CD, they're peer counselors. So they're young adults answering the phone, and then we have clinicians on staff. In addition to counseling, though, we want to do programs in New Jersey like the one we did at MCMC. We want to bring in guys like Mahmoud and other people to talk about their struggles with mental health. And for that, we need boots on the ground, right? We need people in New Jersey to say, hey, yeah, come to NBIC. Let's run a basketball camp. Yep. And then let's have a discussion. We've started working with the Mohsen Center in Chicago, or we're going to start working with the Mohsen Center in Chicago. We want to do healing circles. It's like a study circle, but you come to the circle, bring your parents, and just have a discussion in a safe space about what you're going through, what you're feeling.
So you receive the calls. Do you follow up, and does that person who connects with them, the first point of contact call them back every 2 days, or is it just a one-way street?
Yeah, so what we do is that the names are anonymized on the call center. What we don't want is callers that are coming in to then become dependent on somebody, an individual, as their support line. So our counselors are trained primarily to listen and to assess. And if it seems that somebody's in a situation where they may harm themselves or others, then take the appropriate action. We do allow repeat callers to come in, but if we find the calls are coming in, we do try to point them or direct them to another source for long-term care. Now in Canada, interestingly, we started web therapy. We're actually offering free web therapy in Canada. And now in the US, we're looking at the different states to see how we can do that, because clinical therapy is expensive,
Yeah.
especially if you don't have insurance. So that is a program that we're looking to roll out in the US in the new year, inshallah. But yeah, it's just active listening and making sure that the person who's calling is safe, and then directing them somewhere where they can get help.
Can people text?
Yeah, absolutely. Absolutely. Almost half our calls are coming through text.
1-866 Naseeha, is that for Canada only or the US?
It's global.
Global.
It's
Good,
global.
good.
We're getting people from all over the world.
You don't cover addiction therapy. It has nothing to do with this, right? Someone called, I'm depressed because I'm an addict. I can't stop doing this. Do you cover that too?
Anything,
Wow,
any type of, yeah. So almost half of our calls, I think 39% of our calls that come in have to deal with some type of an addiction, whether it's drugs, alcohol, and unfortunately, the big one these days is looking at things you're not supposed to look at on the screens. That's a big one. And we have people that are actually trying to provide these type of therapies. You had my good friend Dr. Rehan Zaidi on, I think last month or a couple of months
you look
ago.
like his cousin.
Yeah, I don't know who's the lucky one in that example, but so Rehan actually is doing this very same thing with individuals. Like he's bought a place and he's providing this type of personal therapy. So I think there's enough to do that many people can get involved, and we'll still need more help in this area.